Right. So I think we're ready to go, ladies and gentlemen. Good evening. I'm Councillor Crawford. I'll be chairing tonight's health meeting. Thank you for your participation. And obviously this meeting is still virtual, so we appreciate that it's not ideal, but hopefully we'll be able to transact all of the business and ask plenty of questions. I have some apologies for absence, for lateness from Councillor Kate Crawford, who will be here, and some apologies from some of our attendees who might have wanted to attend. Doctors Hilton and Taylor are unable to join us, but we do have a large number of people who are going to contribute to various sections. I'm not aware of any other apologies for absence. Please let me know if anybody has any. But given that overwhelming silence from you all, I'm going to move on to urgent matters, of which there are none that I have been notified of. So we're going to proceed through the business as indicated on the agenda. I do have to ask people for declarations of interest, and I'm going to go to our usual suspects on this. Firstly, Alan Cook, and then Piotr.
Health Watch. I'm on the Committee of Health Watch.
Yes, of course you are. And Piotr?
I'm General Manager of Ealing Community Transport, so we have links with the Council for various contracts and tenders we participate in.
Of course. I'm not aware that anyone else needs to declare anything. Obviously, if you find that you need to, just let us know or write to the officers, but I think we can proceed. There are no matters to be considered in private. Everything is clear to be discussed in public this evening. On that note, I'd like to ask you to approve the minutes of our last meeting on the 8th of September.
Agreed.
But there may be. Thank you. Piotr, are you wanting to agree or you wanting to make a correction?
I'm wanting to make a correction if I can.
Yeah, go for it, yeah.
I believe on page 12, a question was asked by Roy regarding when the Cowgate and Michael Flanders centres were due to open. It's minuted they were both to be completed by the end of September, which I think is incorrect. I think at the time, if my memory serves me right, one was due to be middle of November, one by the end of November, not September.
I think you might be right as well, but I'm going to check. Kerry's nodding at me vigorously. Do you want to come in, Kerry?
Yeah, Piotr is absolutely right in terms of the timescales. Yeah.
So can we
yeah, I'll amend those.
Make that amendment and just check with Kerry and colleagues that what we put in is correct. And if there is an update on when they might open or what maybe we could attach the current position as well potentially, or maybe have the current position stated in these minutes. I don't know what the procedural rule is for that, but that would be helpful in terms of formally updating Roy's query on that. Okay, thank you, colleagues.
Okay,
sorry, Anna.
No, it's fine. I was just going to say that I'll update the minutes with November, and we can put something in these minutes about what the current update is. So yeah, I'll liaise with Kerry.
Excellent, thank you so much. I'm gonna take those as agreed then, unless anyone else has any reasons why we shouldn't. No, agreed. Marvellous. Oh.
Agreed.
Oh, thank you, Councillor Midder. Yeah. Right, I'm going to move on to our first item, which is update on COVID-19 in Ealing, and it's a standard item that we take. Our Director of Public Health is Anna Bryden, and she's ready to talk to us.
Thank you, Chair. Good evening, everybody. I think Kerry is going to be my screen sharer this evening. Kerry, I don't know if you've got the slides to hand there. Thank you. Sorry, my IT for some reason. I'm going to go through these relatively briefly. There aren't any massive updates from the last time we met, so I'll run through the key points, and then obviously happy to take any questions. And then Neha is going to afterwards to go through the vaccinations update in more detail. So Kerry, we can go to slide 3. Thank you. So just really briefly touching on the current situation nationally, it's a really mixed picture at the moment. As you can see from the map on the left, the darker and the more purple colours are the high rates. London is at the lower end in terms of regions across the UK. It doesn't mean, however, that we're at low rates in London. They're still relatively high. We're probably seeing rates in Ealing that are similar to about mid-February. So rates are definitely not at the low end at the moment, but other regions are higher. You might be able to see just from the small graphs at the bottom, the number of people testing positive has been climbing in the last couple of weeks. The number of people unfortunately dying with COVID is relatively stable, but keeps going up and down. And at the moment, we're seeing a bit of an increase in people being admitted to hospital. Not so much in London, but definitely in UK as a whole. Next one, please. So just wanted to highlight, since we last met, the government's published its autumn and winter plan. There's Plan A and Plan B as part of this. I'm sure a lot of you will have seen this in the media. Plan A is essentially carrying on with really giving a big push in terms of vaccinations, testing, tracing, supporting the NHS as it prepares for winter, carrying on with good communications and guidance, and really looking at the kind of risks at the border. Plan B, which is being discussed at the moment, and there's a lot in the media about this, about when this might come in. As I said, some of the regions in the UK are definitely seeing the rates go higher and the impacts on hospitals definitely increasing. So even when this is enacted by the government, it's essentially very much ramping up the communications in terms of the level of risk has increased, and so encouraging more cautious COVID behaviours. Introducing potentially some COVID certification for things like nightclubs and large events, possibly theatres, etc. Bringing back in the mandated face coverings in some settings, for example, in shopping centres. And then again, as quite a big part of Plan B would be encouraging an aspect to work at home they can. I think the modelling done by the government scientists has shown that because of the relatively high rates of vaccinations in the country, you only need a few small things to make quite a big difference at this stage, and that the working from home is probably the biggest thing we can do as a country in terms of reducing those social contacts. So that's Plan B. What we're doing in Ealing is really just looking at almost like a Plan A plus. So what does this look like over the next few weeks as rates start to increase over the autumn, as rates start to impact potentially on people being in hospital? What does that mean for the NHS going into winter, and then being ready locally in terms of even when Plan B does come in? So in terms of Ealing, we're seeing the rates really fluctuate at the moment. Again, they're not low, but they are relatively stable. We keep seeing some little spikes going up and down, but at the moment we're seeing about 1,000 residents a week testing positive. That rate's similar to northwest London, a bit higher than London, apologies, significantly lower than other areas in England. We're seeing the inequalities again getting quite mixed at the moment. At the moment, we're seeing Southall with the lowest rate, and that's been the case for a little while. And we're seeing Hanwell, sometimes Per Vale, sometimes Acton having the highest rates. And in terms of ethnicity, again, that picture is quite mixed. Testing's dropped off slightly during half-term week. That's as expected and in line with the national trend with the holidays. We're still sadly seeing some COVID-related death lower numbers. Next one, please. Thanks, Kerry. So in terms of testing, this is one thing I just wanted to raise here, because this has probably changed quite a bit since we last met. So if people do have symptoms and need to get a test, the availability is still as it has been for the last few months. So we've got the 3 sites in the borough, opportunity to go through sites in neighbouring boroughs and also get kits at home. The bit that we have been pushing on a lot over the summer is what we call community testing. So this is regular testing twice a week, ideally for people without symptoms. As we know, about 1/3 of people with COVID don't have any symptoms or have very mild symptoms. So this is really to support people to get tested just to identify if they happen to have COVID and stop that being passed on, protect people around them. We've got testing where people can get helped to do this by pharmacy staff, and that's at 17 pharmacies dotted around the borough. We've also got lots of places where home testing kits are available. Most pharmacies in the borough, if you walk into, will have home testing kits, and 10 of our libraries as well. What we have been really pushing on over the summer months has been really good engagement with local community groups on not just on testing, but also on vaccinations, other COVID messages, but especially supporting with testing. So this includes places like the food bank, some of our substance misuse services, our hostels have been handing out kits as well. And we've also had really, really good links with some of our faith settings who have been linked up with local pharmacies so that some assisted testing can be doing, so people can be showing how to do the tests, and also home testing kits handed out. So this includes both an Islamic centre and a Gurdwara, and that's really something we want to learn from and see how that's going. And we've also been handing out home testing kits, lots of information at all the different pop-up events and other summer events happening in Ealing. We've mentioned before at this committee that we aren't able to track the home testing kits that are given out, which is frustrating. What we are trying to do is have a bit of a think with our intelligence team about what kind of evaluation and qualitative information we can get, especially from those local community organisations, the pharmacists, the faith settings. So how are people seeing this? Are they using the kits? What other support could we give? So that's work in progress. Next one, please. Thanks, Kerry. Just in terms of contact tracing, I won't go through all the details of this, but it's there if you want to afterwards. Over the summer, as the rates went higher in June and July nationally, the national contact tracing team took over most of the contact tracing for the first 24 hours after somebody's positive result, and then our local team essentially got the cases that were harder to contact and tried to get in touch with those. We've been trying to slowly move back to a situation where the local teams do more of that and get involved earlier. And we've just been piloting that for a couple of weeks now in Acton, where after 4 hours of someone testing positive, we then get the information locally. And we've extended our weekend hours to support with that. And we're also, between now and December, we're also getting additional voluntary staff so that we can really scale that up and increase that 7-day capacity. We're also exploring options for carrying on with some of the door knocking service that we did earlier in the spring and summer to really focus on the most vulnerable people, especially elderly people who might not be wanting to answer the phone or might be very cautious about who's there, or to check on people that might need extra support if they're particularly unwell. Next, please. So next 2 slides are just a very high level summary of vaccinations, and obviously Neha will talk us through in more detail. We've now had about 60% of the population having both doses. It's highest in Southall and Ealing, lowest in Acton, which it has been for a long time now. We've still got about 40% of adults in Acton still not vaccinated. And obviously there's ongoing work there around vaccine equity, vaccine confidence, and really that community engagement work. And a real push on the second vaccine as well as the booster doses. Next slide, please. Thank you. So I know the other Councillor Crawford had asked about some more vulnerable groups at the last meeting. Apologies, the people we'd lined up to come unfortunately weren't able to come tonight. So I'll try and go through this and answer any questions. I can take things back to colleagues, but if you do want more of a focus next time, hopefully we can line that up for the colleagues to come along. We have got a vaccination working group, but we also have underneath that a group that really looks at the vulnerable people, so a kind of inclusion health group, not just vaccinations, but with the COVID vaccinations, there's a big focus of that, and also other winter challenges like the flu jab and the booster jabs. We've got our community engagement team. We've got our each who we commissioned to do some COVID community engagement on the ground. We've also got very strong links with our housing team, our homelessness organisations like St Mungo's, our hostels team. So it was really, really cross-partnership working to reach out to those community groups, address vaccine hesitancy, link people up with where they can actually get COVID vaccinations, but also look much more in the round about healthy living and healthcare. So with the vaccinations just as one aspect of this. HMOs we've touched on a number of times, a very difficult cohort to get in touch with as a specific cohort. We have got regular newsletters that go out to HMO landlords, and we have previously promoted messaging around vaccinations, and we will be doing so again in the upcoming newsletter. But that's a lot of work that's ongoing. It's also a lot of work I'm very keen on pushing over the autumn and winter. It feels like the narrative around inequalities has kind of got slightly dropped nationally. We're not seeing those massive spikes that we were seeing in January, February, but it doesn't mean that there aren't people getting affected by COVID, affecting their everyday lives, potentially end up in hospital. Sadly, obviously some deaths as well, and the inequalities are still there. As I touched on example, ACTA, we've still got 40% of population not vaccinated. It's something we're definitely still pushing forward with, and I can update at the next meeting. Just finally on vaccinations, the other thing that's happened since we last met was that the government has rolled out a single vaccination to everybody aged 12 to 15. So we've been working very closely with colleagues across North West London and all of our schools to make sure that's delivered. We've had over 10,000 young people vaccinated so far. We've had about a 37% uptake rate, but we've still got some schools to go this week and next week. And the government has now opened up the offer so that if people don't get the vaccination through their schools, they can also book in through the normal NHS booking system for vaccinations, which is a number of pharmacies across the borough, as well as CP House. Just moving on then, just a final bit before the key messages is just about social care, and obviously Kerry can help answer more queries about this. We finally got to a really good position in Ealing, and I think the highest in London in terms of staff vaccinations at care homes. So we currently at about 98% of staff in care homes got their first vaccine and 93% second vaccine, which is amazing when you look at any kind of vaccination program. We're now obviously pushing very quickly through in terms of the boosters and the flu vaccines for residents. So we're at really good uptake for those. So 72% for flu, 72% for booster, 79% for flu. We're having there are some difficulties in terms of recording the care home staff uptake of those. Some still aren't due for their booster yet. Others are saying they're not taking them up as a non-mandatory, and it's just really hard to get that data, but it's something we're working on. As we've mentioned here before, we still have concerns about the domiciliary care staff. We've still got about 500 staff not vaccinated. We are currently waiting for the results of the national consultation about whether wider NHS and social care staff will need to have a vaccination in terms of their employment. That's probably due quite soon, but that would obviously include the domiciliary care staff, so that will be discussions to be had over the next few months. And then just finally, Chair, just some key messages to share. We've been doing an awful lot of communications and engagement through multiple routes in terms of testing at schools and universities. Oh, thank you, Roy. We're asking children and young people that before they went back to school or university this week to take one of the rapid COVID tests, and also to report the results and keep testing twice a week, and really to help keep everyone safer and help keep everybody in education. We're also doing a lot of communications at the moment in terms of the upcoming winter months, so especially for the flu vaccine and COVID vaccine, and really trying to advertise where people can get their their flu vaccine, apologies. for example, GP surgeries, local pharmacies or hospital appointments, and really trying to push those messages. I think it's really important more than ever this winter. I think there's a general view that because of the social distancing last year, people didn't get the natural immunity to the flu strains like they would do normally. So it does feel like more of a risk this year, and something that's even more important. And just the next final slide, Kerry, thank you. And then just to say, Dominion Centre running on some Saturdays for vaccinations, and I'm sure Neha will touch on in a minute. And the booster vaccine, we're having lots of communications and engagement messages out there about making sure you get your booster. So if you're either over 50 or have a long-term health condition, or are NHS or care staff, and it's been 6 months since your second vaccination, then you're eligible. There's lots of resources out there to support people, both in terms of FAQs and in terms of booking, and really just encourage everyone to take a look at those. That's all for me, Chair. Thank you.
Okay, thank you, Anna. Shall we go to Neha straight away?
Thank you. And I will share my screen as well. Bear with me. Some of my slides are a duplication of some of the work that Anna talked about around terms of vaccination. So I will restrict the slides that I talk to, particularly around the areas that just delve into a little bit more detail. So as per usual, this is our usual update. This is from PHE data from this morning, yesterday morning actually, around the number of doses given for first doses and second doses. And if you look at the 16+ population, this gives a coverage of 67.1%. And although we've started to give and we've gone quite far in giving the 12 to 15-year-old first doses, I've counted the 16+ here, and then 61% have had both doses. So it is great. And what you can see here on the left-hand side is age range. The green is where people have had both doses, the blue is where they've only had one, and the grey is the unvaccinated. And you can see that by age group. And on the right-hand side is the take-up by ward across Ealing of first doses at the top and second doses at the bottom. And you can see that there is still some catching up to do with second doses. This is a bit of a demographic breakdown as well on first doses, and then the gender as well. And this is the first dose and this is the second dose. And then by ethnicity as well. So some of the data that Anna was talking about broken down in a bit more detail. So Anna also spoke about the schools programme. It's really been fantastic. Villiers School was one of the first to go live in northwest London, a really high take-up rate in the school of the vaccination, the one dose. So and some amazing work from the head teacher and all of the staff there as well. So it was a real learning exercise for everybody in northwest London on how to run the vaccination programme in schools. And since then, we've gone from strength to strength and going into schools across northwest London to vaccinate staff. And we've had a considerable ramp up over the last 6 weeks with more schools happening over the next 2 days, and a few more next week, and then we would have been round to all of our Ealing schools very shortly. There has been an increase in anti-vaccination messages and demonstrations, which have been small and disruptive at times. No significant events in Ealing, but the situation is constantly being monitored, and we do keep all of our partners up to date with everything that's going on. Over the half term, when schools were closed, we also had drop-in sessions at CP House on Ealing Broadway, and around 1,000 something vaccinations were done for school-age children over that half-term period. 30% of those were Ealing children done at CP House, which was 401 vaccinations. So it's some really impressive work that's been going on, and CP House has been a real asset for us locally. And just this last slide, which I will just quickly go through around the booster program. As of the 25th of October, our booster program had started. So we've got about 126,000 patients who are eligible for a booster vaccination. However, not all of them will have met their 6 months between after the second dose to then receive their second dose. And we've done about 46% of the currently eligible population. That was as of 25th of October. I haven't got more updated information than that. And as Anna said, Dominion Centre is now live on the national booking system for all age groups, and the link is there. Moderna is another vaccine that has been approved for boosters. All of our sites have been offered it, but currently nearly all of our sites are just sticking to Pfizer. There are a couple of sites that have taken up the Moderna and were giving Moderna actually before it as well. But it is likely that more sites may come online with Moderna as well shortly. And the housebound vaccinations has started slowly, but due to the fact that it's much more difficult giving the vaccination, which is a Pfizer, because of the transportation limitations that we have with the vaccine, the time in which that vaccine has to be used once the vial has been punctured, the infection control requirements that we have to adhere to, and the 15-minute observation time. As you will remember, when we did the housebound patients earlier on in the year, we were using AstraZeneca, which didn't have that 15-minute observation time, so you could do a lot more patients in a shorter period of time. But this is taking a bit more of a time and is a bit more of a challenge in terms of running the vaccination and not wasting any. And just below is just a current take-up rates of the vaccination, the booster vaccination, with our PCNs, our primary care networks. Some of our lower sites are either because that PCN isn't delivering vaccinations themselves and they are encouraging patients to take it up at local pharmacy sites. But some is also because one of our sites at Grand Union Village just started a little bit later than the others, so it will catch up. And that is all I was going to cover off. Happy to take any questions.
Well, thank you, Neha. Can I ask that a copy of those presentations is sent to committee members following the meeting so that they've got that information available to them? That would be useful. Right, I've got Councillor Conti first.
Thank you. I had a couple of questions. One on sort of schools and sort of whether there's been sort of significant outbreaks of COVID and sort of impacts on kids missing school in the first half term, and obviously they've only just restarted, but if there's any information on that. The second thing on the first doses being given in schools, I think, Neha, you mentioned, I think there was a couple of schools left to be done. I think it sounds like it started off really well at Villiers, and I think the uptake, I think you put on the slide, was 30 so far is 33%. I think with only it sounds like only a few schools left. What do we envisage the overall take up to be? And in each school, what is the take up? Is it 50%, 60%, 40% of kids in schools taking up the offer? I think it's also mentioned in the slides that the offer at half term to go into CP House was less than expected. So has there been some sort of reservations about it? Because I think nationally there's a big difference between the uptake in Scotland in children between the ages of 12 and 16 to England. I was just wondering, I think that there was some commentary about that being because it was in Scotland you could use the walk-in sites and the NHS sites, and in England it was initially in schools only. But that doesn't seem to have made much difference in the fact that in half term that was opened up. And then my final question was on boosters. With 46% of the eligible cohort have been done so far, obviously, as each day goes by, more and more people are becoming eligible. What's been the limiting factor, which has meant only 46% of people have been done so far? Has that been a capacity issue in terms of being able to get vaccinations, or is that just the speed of which people are coming forward? And do we have enough capacity going forward to enable us to catch up the people, the sort of half the people who haven't had it and have been eligible so far, plus, as I say, each day going on, more and more people becoming eligible. I actually had one other very short question, which was obviously there's some people who haven't had a first dose at all, and so much work has been done, by the council, by the NHS in trying to reach out to different communities in terms of providing access to vaccination in different ways, etc. What else do you think can actually be done on top of all the incredible work that's been done already that would actually encourage that 40% of people who haven't been vaccinated so far? Like, realistically, what more can be done? Because I think so much has been done. It's quite hard to think of what additional work can be done in terms of that. And what could councillors or the council do to assist if there's any sort of other ideas in that area?
Right, thank you, Councillor Conte. It's a lot of questions. Let's see how we go in terms of getting through. Anna, would you like to start?
Yeah, I will do. Thanks, Councillor Conte. So I'll start with this first schools question, and the others chip in at the end if that's okay. Especially around the vaccine. Schools, Councillor Conte. We haven't seen any large outbreaks. We have seen. I'm just going to turn off my video if you don't mind. My signal's going. I hope you can still hear me okay.
Got you fine. Keep going.
Okay, thank you. In terms of school, we haven't seen any large outbreaks. We've seen lots of small to medium outbreaks. So we've had an awful lot of schools who have had what's termed an outbreak, but is essentially just 2 or more linked cases within a few days of each other. So we've had lots of schools where there's been a few cases. I don't have the number to hand. Apologies, Councillor Conte. We have had a number of schools that reached the Department for Education threshold. So that was where you had 5 or more cases linked within a few days of each other, either in a friendship group or year group or a staffing group. We did have a number of schools that met that threshold. They went through their measures with our Public Health England colleagues in terms of what else they could do. So it was really considering again how many activities could be done outside, for example, which obviously gets harder into the winter months. Thinking about masks in some settings, thinking about essentially upping the messaging around testing and really supporting families with that. It wasn't reintroducing any blanket measures. I know a couple of places in other regions in the UK have introduced blanket measures in terms of face masks, again in secondary schools, or reintroducing bubbles. We aren't there yet in London. I think there will be a question of when that might become useful, but it isn't something we're encouraging at the moment. I think it's things going into the autumn when outdoor activities become harder, that it's really thinking through with schools about things like, say, parents' evenings, open days, that kind of thing, where you've got people coming into the school environment that wouldn't usually be there, and mixing with people they don't usually see. So really thinking about things like face coverings, virtual parents' evenings, that kind of thing, but they're discussions we're having with schools. I hope that answers your question enough. Neha, if you're happy to kick off with the vaccines and then bring me in.
Yeah, sure. Unfortunately, I don't have the figures to hand about their uptake rates at schools, but we can try and get that to you and share that as soon as possible. But it has varied across even the first 2 schools we did in Northwest London. One was in the 80s and one was much lower than that as well. That was across Northwest London, so I'm expecting the same across our Ealing schools as well. In terms of capacity and the take-up rate of boosters so far, and I'm sure Dr. Shankar Vijayadeva, who's stepping in for Dr. Taylor, will have more to add here, but we had a lot of hesitancy initially, or a lot of people just not coming forward and booking their appointments when initially the slots were released. That has really taken up over the last few weeks, and the sites are a lot busier and much less DNAs, which is great news. Capacity isn't an issue. We have increased the number of pharmacy sites available across the whole of Northwest London, but including Ealing, where we had the largest number of pharmacy sites already. So we don't expect any risk in terms of capacity. So there should be more than enough capacity to vaccinate all of the people coming ready for their booster vaccinations. And what more can be done? I think that's the million-dollar question at the moment for me. If anybody has ideas, I'm all ears, to be honest. Anything we can do to increase people taking up the vaccine. I think what has been really good and some learning over the last few months is when we opened Dominion Centre for walk-in, which they are doing some of that now, and used local people to go and talk to local people, and in some of the shops, estates, to encourage them to come and take their vaccine. It really, really helped. It didn't help in Acton for some reason. We weren't able to get the same uptake rate in Acton, but in Southall we knew that there was a lot of unregistered population there. They did come forward for their vaccination, and there is a lot more work that can be done. So having walk-in capacity at the right times is essential as well. And now that Dominion Centre is also on the national booking system, that will help, as well as all of our other sites on the national booking system as well. I don't know if Dr. Vijay ever wanted to add in.
Yeah, sorry, Dr. Shankar, would you like to go ahead? You're on mute, I think, at the moment.
Yeah, so just a couple of extra quick comments. You mentioned about the operation model. You asked about, is Glasgow or different countries, different model with the school kids. I think there is partly that could be an influence. So one practical experience I've seen from when I've assisted school is you arrive there, the school teachers have, maybe got 150 kids, like chase the parents, then suddenly on the day, there's floods of extra forms or parents whose last minute responses, despite their chases to, hit deadlines. And then actually the vaccination team can't do those extra kids because of the whole vaccination transport, and you can't bring extra vaccine and then waste it, and then you just don't have enough time to get it. So there is some logistical issues about roving teams, and then maybe that peer or herd effect with parents, that there's an indecisiveness. Then suddenly that last minute, when they suddenly realise that other parents or other children getting done, that there's a sudden change in decision making. But then to counter that, obviously there were those extra clinics run in half terms and things which gave some other opportunities. There may be some part about that model, and is there something that can help with schools? And with the booster thing, I personally think that the national media stuff probably, you obviously had the society professional about first dose, second dose. Maybe there seems like an element of fatigue where you start to wonder where is it ending, and maybe there just hasn't been as much marketing about get your booster as much as maybe the first dose and second dose. So there's definitely an element there about potentially could be more about that importance. And then finally, the hesitancy issue, obviously, first with AstraZeneca and then Pfizer, some later cases. But then also, sometimes a lack of clarity at the beginning about what is the booster, what is it, they have a choice of preference. But generally, I think it's just maybe also slightly in the autumn effect. If they're slightly more unwell, they're juggling where they want to have their flu jab first, have it together. So sometimes it just adds a bit of delay.
Thank you. Anna, you put in the chat, I don't know whether, shall I read it or do you want to read it? Go on, Anna.
I can read it. I can read it, Chair. Yes, so we're still gathering the data for the schools. Obviously, some are still being done or being visited for extra days. The last I saw about a week ago was you got uptake rates between about 25-30% in some schools and almost 80% in other schools, with Villiers being a really good example of that. We are looking at that data in terms of inequalities and really seeing if some of the trends are coming out like we're seeing in the adult population, and obviously that will get added then into our kind of community engagement plans going forward, but we are just waiting for some of those schools to be finished off, and then obviously the half-term offer there as well. Just very briefly, Chair, on Councillor Connor's question around the vaccine hesitancy, it's something I've got as that is my massive task for the autumn and winter. Those rates of in a lot of parts of the borough of who hasn't had the vaccination haven't changed much over the summer. So we got to probably about July. You were still getting obviously some people through, and especially in those younger age groups, but the adult population hasn't changed much. I think it's carrying on pushing on the community engagement. We've got our own community engagement teams across the council and the NHS. We've commissioned a service called Each, who go out and do a lot of our work with community groups on the ground. There's a lot of listening to people and having those as conversations rather than just information given. We've also more recently had some of our teams going out into schools and actually having those conversations as well directly with young people. So it'd be really good to hear from them over the next few weeks. But it's definitely, like Neha was saying, is really finding those community leaders who can support that work and carrying on just having those conversations and hopefully getting those rates up slowly over time. But it's not an easy task.
Okay, thank you, Anna.
To ask also, Midda.
Hold on, Councillor Midda. Yeah, I'll come to you. I've got a couple of people just before you, but I'll make sure that's okay. I've got Matt Van Mol Jones from Health Watch.
Yeah, thank you. I was just hoping for an update or maybe some clarification around how we're supporting undocumented individuals with receiving their vaccination. But I know Anna said a couple of people aren't on the call this evening. So if that's not possible, I'm happy to take this offline.
Can you speak to that, Anna, briefly?
Yeah, it's we can maybe follow it up separately, Matt, in more detail, but it's really going back to that inclusion health group. It's really working with a lot of those charities that work with, say, homeless groups through the hostels, etc. I think we've carried on again with the communications that we've been doing with our NHS colleagues for months now in terms of you don't need documents, just come along. That might be something as a booster gets rolled out more and more on the flu vaccinations that we need to do another push on, because I think it is a really important message and a really key one for people to understand. It isn't just, you know, the drop-in clinics, it's everything, but definitely can try and provide some more info, Matt, on that.
Thank you. So yeah, if we can follow up with that with an email to colleagues with some extra information, that'd be appreciated. Right, at the moment I've got Councillor Mohan and then Councillor Midda. So if anyone else wants to ask a question, can you use the hand function or tell me in the chat function? Councillor Mohan.
Thank you, Chair. My question is just a technical one, but before I do that, I want to say something about the booster walk-in centers. I went to one recently and it was well organized and very efficient, well done. The question is that I asked for a certificate, not a certificate, a card, and they say that you don't need a card for this, but in case of other two vaccinations, we received a card that you have received this vaccination on this date and so on. So I want to find out whether we need a card, because we may need to travel and we may need to show it. So what is the position about that, please?
Sure. So you can download your proof of vaccination through the NHS app. You can get it sent to you, but Dr. Shankar is going to tell you more.
Yeah, so just some basics. You know, the cards that were produced nationally, they were really only designed for first dose and second dose, the way that they were printed. So they never designed a custom-made booster third dose. I do think there's some confusion. A lot of us just give that same first dose, second dose card and just scribble booster or something on it. So I don't know exactly what happened in your experience. I mean, which walk-in centre was it, if you don't mind? Where was it?
It was organized by a private, by a pharmacy in Green.
Okay. So I don't know what happened in their case, but most of us are just using the first dose, second card and just scribbling out and writing it. I also think it's especially because so you know about the proof about the NHS app. I've had different versions. I've even contacted 119 and run through different things. You know, some people say, you know, that they, you know, when you download the certificates data from the app, it's at the moment not showing the boosters. You can still often see it in your records. One little bit of further information, and it's a bit of more technical stuff, is the NHS for eating practices. Most of us are using IT System 1. The NHS app from December will start to show you actually your full record access from December onwards by default. So you actually can see things and notifications, even if it doesn't seem to come through the COVID bit of the app as well.
Actually, what I found confusing, I had a friend with me. He told me that he showed me the card he was given when he received a booster. But here they were saying that you don't need it.
Okay. Personally, I'd always recommend a patient or someone does try to get that card, because it acts as a backup, because we do have sometimes data failures where the data just is inputted into that system and it just doesn't get saved and that card can be really valuable to show to someone if you need to find correct data issues. So I think you're right to have asked for it. I don't know, you may you may want to go back to pharmacy and ask for information, but if you do end up finding it in your NHS app stuff, then obviously that is the main proof you need. The card is not that useful. It's only a backup if it doesn't get through into the NHS app.
It will be helpful if there can be a uniformity in the approach.
Yeah.
Thank you.
Thank you, Councillor Mohan. I'm going to go to Councillor Midder now. Councillor Midder.
Thank you, Chair. First, I want to clear Karam Mohan's question. I got a COVID booster on Friday. I got the small card. I went to CP House in Ealing. So they give me the small card for the record. I got it. Can you hear me?
Yes, I can hear you, Councillor Midder. We're hearing you loud and clear. So you've told us about that. Can we move on to your question when you're ready?
My question is that from Anna, the week 9th of October to 15th October, the death rate is too high, 903. The people have both vaccine. So why is so much the death rate? And another question is Neha, I have a booster, my vaccine. So how long I have to wait for my flu infection? Thank you.
Right, so taking those in turn, I think the 903, Anna will correct me, but I think that's cumulative. I think that's all the people who've sadly passed away. They didn't all pass away in that week. So there's only been 2 or 3 deaths in that time span. 903 people have died since the beginning of the outbreak, is how I read it. But correct me if I'm wrong, Anna.
No, that's correct, Chair. Thank you. And when you look at our overall death rate, so per 100,000 people compared to other areas, we're similar to other areas. Like I said, it's very low. It's not 0, sadly. And we are seeing some higher deaths in some other regions in the country. But London at the moment is at a relatively low rate. Thank you.
Thank you, Anna. Thank you.
And Neha?
Thank you. I'm sure Dr. Vijay Deva will correct me if I'm wrong, but I don't believe you have to wait any time between the 2 vaccinations. In fact, I had both of mine on the same day, 1 on each arm, and luckily I was fine. So,
Dr. Shankar, sorry.
No, exactly the same. So there was obviously a debate about whether you need to gap or give together, but I think most people would feel comfortable to give them together if the patient felt comfortable too.
Sure. Karam, is that, thank you, Councillor Midder. Karam, is that a legacy hand from your previous questions, or do you want to ask another one? I'm going to assume, Karam, that you've already asked your questions. I've just got Roy Willis from Ealing Social Care, Reclaiming Social Care Action Group, asking about the situation for booster jabs in Greenford, Northallerton, Perivale, and home visits. This is one of those ones where this might be one of those areas where we haven't yet organised the home visits. Is there, Anna, can we speak about that? Can we get Neha?
I think it will be, me, so I can give an update on that. Greenford, Northallerton, Perivale areas is the PCN, the primary care network called NGP. When the vaccination enhanced service was released nationally, it was a choice for primary care networks if they felt they couldn't safely run the vaccination program as well as maintain primary care provision, that they didn't have to take up the vaccination program, and it was up to us as commissioners and providers across Northwest London to come up with other plans to ensure that there was enough vaccination capacity. So that's where the pharmacy sites have been increased, which is where patients can get their vaccination for those areas. But for the home visiting, for the patients that need home visits, it will be the same team that's going out to do schools at the moment. And as you can imagine, they're focusing on schools at the moment. That team, we call them the roving team. So they very much know that this primary care network has opted out of delivering the vaccinations themselves. So we'll be supporting and working with the practices to go and do the home visits as soon as they can. But it's likely to be towards the end of November.
Okay, that was what I was going to follow up with asking. Roy, you've come off mute. Did you want to add some comments or ask a further question at this point?
Well, just to say that obviously there are some people who do need to have a home visit for various reasons of complex health needs or mobility problems, and it seems that it's happening in other parts of the borough, but not in Greenfoot North or Perryville. So it's just I don't know what the numbers are, and obviously the schools teams are very busy, but hopefully they will be able to visit people, or perhaps if they can arrange for people to be transported to the local pharmacies with support.
So Dr. Shanker's got his hand up. I don't know whether I should take him
Okay,
first. Yeah, go ahead.
Would you mind if I just respond to that very quickly?
Please.
So, you know, we've obviously presented about the housebound challenge there, and this is where I think we do need to work collaboratively, because it is really a big challenge. That Pfizer dose with that 15-minute observation and that vial and not wastage. So, you know, it's a difficult challenge than the previous time, and also it's a different time of the year. When we did the first dose in sort of January, now we're in a different zone, and you know, all the logistics of trying to do those routes, the patient being well in this, that observation period. So I do think if we work collaboratively, where if the public and patients knew that if there was a way they could get to a base, you know, and it could even be that often that they could drive in a car, stay there. Sometimes people can come out to them and they can stay in a vehicle with someone close by. If there's things that could help the system deliver their dose faster, then that would really help. Because I appreciate that in terms of housebound, there are degrees sometimes of what they can sometimes do in terms of if they've got appropriate transport. So I do echo that, you know, it is, you know, we do obviously want that priority group to get it as soon as possible.
Thank you. So just on this, Piotr has put in the chat, I'll read it out for those of you who aren't able to look at it at the moment. The ECT is currently transporting patients with mobility issues to the Greenford pharmacy sites free of charge via their GPs. So some of that work is going on, and I know ECT will support, but I think Nahar was saying that the roving team will get around to most of these patients by the end of November, but clearly we'll look at and monitor, and that's a very important role for all of us. If we hear of individuals who are having problems accessing support and indeed the vaccines themselves, then as always, we can notify Anna, Nahar and various colleagues of cases that need particular attention. That's an important part of our role as counsellors and as this panel. I don't have any other indications at this point. So there are two things I'd like to say to finish this item. Firstly, thank you to our officers for their continued diligence with regards to COVID, and obviously a massive thank you to everybody involved in the NHS, to Nahar, to Dr. Shanker, to all the colleagues who briefed us previously on this, and the volunteers who are doing such a great job with getting the word out. What I would say as well is on both Anna and Nahar's concluding points about continuing to spread that public messaging is an important role for all of us to carry on doing. So thank you very much for being able to speak to us this evening. If we can have some of that information sent in the next day or so, that'd be really useful. Copies of the slides would be great as well, and I'm sure everybody wants to pass on our thanks for all the hard work that's going on at present. Thank you very much. Right, so notwithstanding the importance of that item, we're going to move on to the lessons learned in adult and social care, and I think this is a joint collaboration between Matt from Healthwatch and Kerry Stevens, our Director of Adult Services, both of whom we see regularly here at this panel. I don't know who's going to go first. Matt, is it you? Is it Kerry? Oh, I'm sorry, I've relegated you. Go ahead.
That's no problem, Chair. Thank you. I'm just going to introduce the report, if that's okay, Matt, to say that you'll recall we've previously discussed in this panel meeting the Lost, Abandoned, Forgotten report that was carried out nationally about the impact of COVID on vulnerable people and people with disabilities. As a result of those discussions, we commissioned Healthwatch to carry out a survey and interviews of the impact of COVID on people living locally in Ealing. I think this is a really progressive step, and it's a really strong step forward, and shows that the council and partners are open to investigating and looking at issues and challenges during what's been an extraordinarily difficult 18 months. And following the report, what I'll propose is that we'll develop an action plan on some of the suggestions that Matt is going to come forward with now, of the recommendations. So thank you, Chair, and I'll hand over to Matt, if that's okay.
Lovely, thank you very much, Kerry. I'll just share my screen, and we've got this handy infographic, which I hope you can see. Okay, so let me make sure I've got my notes as well. There we go. Okay, so our Disabilities Research project looked at how both individuals living with disabilities and informal family carers had been impacted by the COVID-19 pandemic. Through partnership with Ealing Council, we were able to collect 152 responses. This breaks down to 90 individuals who were living with disabilities and 62 family carers, informal carers. 72 of the 90 were individuals who responded to our survey. We sent out paper copies to Ealing social care customers, and 72 sent copies back or conducted interviews over the phone if they're unable to send it back. And we also held 2 discussion forums, one with the Ealing Women's Hard of Hearing group and one with the Power group. And in total, 18 people attended those. The health conditions range from mobility issues to learning difficulties, mental health needs, autism, breathing difficulties, and visual and hearing impairments. And we asked participants a range of questions focusing on social care, support, healthcare, how they had felt the communication of the COVID-19 pandemic and the vaccination had been carried out, and their mental health as well. So looking at social care support, 53 out of the 72 individuals who completed the survey received support from Ealing Council. And as we go through the report, we'll just touch on these 53 aside from the others to highlight some of the work that Ealing Council is doing. First of which being that 39% of these individuals rated Ealing Council communication regarding their care as either good or very good. One individual indicated that they wished it remained consistent for them throughout the pandemic, and others suggested that it was insufficient in meeting their needs in terms of the changing social care services that they were provided with. Taken together, these findings point towards one of our recommendations around the consistency of communication, which I'll come on to towards the end. The standard of social care delivery was also highlighted in this report, with 60% of participants receiving the same or more social care during the pandemic. Many individuals highlighted how essential this was for their daily needs and their overall well-being. However, again, the inconsistencies were apparent, with some suggesting that the care was insufficient. For example, carers not staying for allocated periods of time. But of these 60%, there were some that were incredibly complimentary of the standard of care they received. Although not directly related to social care, 28 out of 68 individuals indicated that they experienced some difficulty in obtaining food during the pandemic. And again, we'll come back to this in one of our recommendations. We then move on to their access to healthcare during this time. So individuals living with disabilities were mixed in their response in terms of how they access GP services. 59% of participants experienced difficulties in booking a GP appointment during this time, which is somewhat unsurprising. A few praised the digital approach to care, saying it benefited them, but most struggled with the reliance on digital technology for booking their GP appointments. And participants highlighted the fact that the one-size-fits-all approach doesn't work for people with complex healthcare needs. It also caused feelings of anxiety, frustration, and hopelessness in many cases. So this kind of led on to impacting individuals' mental well-being as well. Individuals are very complimentary of pharmacies during this time. Participants suggested it was a relief that they got such efficient support with their prescription deliveries. And most notably for hospital services, 89% of the individuals who had appointments postponed or cancelled during the pandemic have since attended or at least rebooked their appointment. So that's very good news. For individuals' mental health and well-being, again, unsurprising, 70% said their mental well-being had been impacted during the pandemic. The highest percentage of individuals suggest that they relied on friends and family for mental health support during this time. And although this support can't be overstated, the current data does suggest that it's not sufficient in meeting individuals' mental health needs. So more professional support would be required here. And this leads on to one of our recommendations. In regards to the COVID-19 pandemic, the communications around COVID-19 itself and the vaccinations from Ealing Council proved very effective. Most individuals indicated that they felt informed around the use of face masks, COVID-19 testing, and social distancing. In addition, 84% of individuals felt informed about the COVID-19 vaccination rollout. And most individuals were happy with Ealing Council's communication around the vaccine's effectiveness, its role in managing the pandemic, and how to access the vaccine. There were some areas of confusion or maybe not quite enough communication, and these were around shielding, contact tracing, trusted sources of information, and the safety of the vaccine, with these latter two most likely contributing to each other. We then move on to the discussion forums. So this was a kind of thematic analysis of the discussions that took place, and we highlighted the main themes that came from this. The first main theme was, again, around the lack of communication from health and social care services. This related to changes that were made to individuals' care, as well as the rules and restrictions pertaining to COVID-19, particularly around how to obtain the vaccination. 3 out of the 18 attendees had not received their vaccinations, and they indicated that this was due to a lack of trusted sources of information and a lack of communication. This is what led to their decision to not take the vaccine as of yet. So this is something that can quite clearly be addressed. Particularly concerning was from the discussion forum with those who attended the hard of hearing group. They outlined some very practical issues, which we found quite worrying, particularly around the lack of communication and lack of access to services. Individuals who are hard of hearing had real trouble speaking to people over the phone, speaking with people who had to wear face masks, so any healthcare professionals who had to wear face masks, and also a lack of BSL interpretation for when it was needed. And this related to online sources of information, so any videos or content of that nature, as well as any in-person interpretation that was needed. So there seems to be a real kind of gap in service for those who are hard of hearing, with these practical issues not really addressed for these individuals. Moving on to individual social care support, this was the second most identified theme. 13 out of the 18 discussion forum attendees received their social care from Ealing Council. There are a number of contributory factors, but all attendees felt that their care had decreased during this time, with the knock-on effects being realized by many as family members had to step in to care for these individuals, and it obviously impacted on their own health and mental well-being as well. Some attendees indicated that they had not received essential equipment, so mobility aids and hearing aids, things like that, and this left them feeling ill-equipped, unsupported, and in some cases hopeless. One thing that is worth noting is that attendees at the Power Group discussion forum were full of praise for both Ealing Council and the staff and volunteers at the group that supported them, because during the second lockdown, Ealing Council provided them with digital devices to support with things like their education, GP appointments, even just looking at the news and keeping up to date. And staff and volunteers at the Power Group also provided regular support for their attendees by providing regular daily checkup calls. And this is something that really supported their mental well-being. In terms of healthcare access, again, people felt generally disempowered by the fact that they had to gain support from family or loved ones to access healthcare appointments, and then they felt that they weren't accurately able to get their ailments or concerns across over the phone as they would during face-to-face. And this is particularly felt by those who are hard of hearing. And again, attendees agrees that pharmacy service delivery was outstanding for the most part during this time. Much like the survey responses, attendees at both forums all felt that the pandemic had affected their mental well-being. Individuals referenced inability to meet with family and friends due to shielding as a key contributor to this, as well as the stress, anxiety, and worry that came with trying to keep up with the persistent changes to the restriction guidelines. And this is potentially an area that, that could be looked at in terms of improving the communication. In terms of digital technology, I've already mentioned the work that Ealing Council did with the Power Group to supply those individuals with digital access. And this is the interesting point, I think, is that it's not a lack of training or skills in most cases for individuals living with disabilities. It's the fact that they just don't have access to digital technology, and this needs to be further explored. Moving on to family carers and what carers said to us in this report. Many individuals touched on the significant physical, emotional, and mental fatigue that they felt. And this was due to things such as trying to juggle their full-time job with caring for their loved one, worrying about the number of COVID-related safety precautions that they had to ensure themselves and their loved one follow, feelings of neglect from services and an overall distrust in the system, with one participant stating that they felt unpaid carers had been used and abused, and another saying, "I just wish there was more reward for the hard work that we've done during this time." Obviously, carers have struggled with their own mental well-being during this time as well. And one of the main things that they mentioned would have supported this was effective communication around their loved one's care. And this kind of transparency and inclusion in communication is something we come back to in the recommendations. Another particular point was the guilt around not being able to offer the right support, which was a really interesting theme to come out of the feedback from carers. And kind of in conjunction with this is that there was no respite for carers, and that this needs to be looked at as the emotional challenge to keep the mood uplifted for both themselves and their loved ones is both physically and mentally draining. In terms of the care received, 16 family carers were negative in their comments, and 19 were positive in their comments about the care that the formal care that their loved ones received. One individual stated that there's no support and that I'm providing all the support, while another stated that staff always called them to check up and even sent a wheelchair and a stick, to support my father's mobility issues. So this just illustrates the kind of mixed response and feedback we receive from carers in terms of their loved ones' formal care. Out of the total number of carers who responded to this survey, 45% felt that they weren't adequately informed about the changes that have been made to their loved ones' care. And of the individuals that received care from Ealing Council, 30% of their informal carers indicated that they were not sufficiently informed about changes to their loved ones' care. So moving on to the recommendations, I'm just going to go back to the report itself to make sure that I'm covering this. So our recommendation area 1 is around communication, which we've obviously highlighted throughout this report. In particular, it's for Ealing Council to ensure that changes to social care are communicated effectively and consistently for all individuals that are receiving care. We would also suggest that this includes family carers where possible, and maintain as much transparency in the changes as possible. Another thing would be to provide clear instructions for individuals of how they are able to contact their social care provider. And this should take into account their preferred method of engagement, and consider implementing a single point of access system for these individuals to contact. There should also be further exploration around the collaboration between Ealing Council and mental health community support services to ensure that individuals have access to those mental health support services. And lastly, around communications, it's to maybe understand and explore what was so effective within the comms strategy around COVID-19 and the vaccination, and understand how this could be replicated for other areas of social care. We then move on to the standard of social care and how this could be improved. We would recommend implementing a more person-centered approach, which could include a core offer for social care providers to implement, providing a kind of standardized outline of service, and then looking at how you would incorporate additional provisions for those that need extra care. This should also include understanding individuals' level of digital access. The standard of care should also be kept consistent as high as possible. This should include social carers staying for the allotted amount of time, necessary equipment being provided, and if possible, time in social care staff's schedules for training and development, particularly around the use of PPE and just general training and development around how to care for somebody. In terms of healthcare access, the most prominent recommendation is to address the inequalities for those that are hard of hearing. So this is addressing the practical issues as well as looking into interpretation services. It's also to consider the implementation of the same telephone system across GP practices where possible, because this may address some of the inconsistencies we're seeing in people's access to appointments. Healthcare services should also support in the drive in access to mental health support services in any way they can, whether this is more communication with patients around the access they have to services and what's available, or flagging individuals to social care providers. We then have recommendations around basic provisions, and this includes digital devices and skills training. So we'd recommend that we look into how to prevent any future issues with access to food for this particular population. If any kind of lockdown or similar situation were to happen again, it would be important that these individuals did not struggle to access food. There should be more collaborative efforts between Ealing Council and community transport to drive accessibility for disabled individuals. And we should also be looking into how we can provide more electronic devices where budgets allow, using the Power Group as an example of how well this has worked. We then move on to the recommendations for support for carers, and this is largely around implementing any kind of respite or short breaks, resuming daily activities for individuals living with disabilities will definitely help with this, but we would also recommend looking at more formal respite or short break activities for family carers to ensure that their mental well-being is being attended to as well. They should also have access to the mental health services that disabled individuals do too. And then lastly, the final recommendation is that we continue this work as Kerry alluded to earlier. So Healthwatch recognises that this research is the start of the borough's work on health inequalities experienced by disabled individuals and their carers, and not the finished article. Further analysis of the current and future feedback is required as part of this continued work to identify any themes related to ethnicity, age, area of residence, and/or level of deprivation, to understand any areas of care delivery that deserve prioritised focus. And that brings it to an end. So I'll stop sharing my screen, and I'm happy to answer any questions or pass back to Kerry if need be.
Sure, thanks, Matt. What I'm going to do is I'm going to ask Kerry if he's got any comments that he wants to make in response, because I think it'd be appropriate for him to speak on, particularly on the recommendations, Kerry, and the things that Healthwatch have identified that require improvement. And then with the committee's approval, I'm going to ask Roy Willis to ask his questions, because he has a few of them, and I want to make sure that they're given the time that they deserve. And then I'll go to the wider panel for questions, comments, and the like. So unless anyone's got any problems with that, and you please do indicate if you do, I'm going to go to Kerry, and Kerry can give us his comments anyway immediately.
Thank you, Chair. And as I mentioned earlier, I think this is really important for us and for this committee to hear this report and to receive this report, to give insight into areas of opportunity and development for us to improve outcomes for the communities that we serve in Ealing. What I'd propose is that the committee asks us to bring back an updated action planning report around the outcomes of the surveys completed by Healthwatch. I think we need to reflect that it was an extraordinarily challenging time for people who use services and vulnerable people in Ealing over the last 18 months. I think services worked very hard to provide the maximum support that we could, and but there's always opportunities for us to grow and improve our offer, and I think that's what's so healthy for this committee to hear this report and for us to develop action plans around it.
Okay, thanks, Kerry, and thank you for the commitment that you want to give the committee an update on actions taken. At this point, all I would say is that some of those criticisms are quite damning. Some of the testimony that is within the detailed report is quite concerning. And I think it's appropriate that we should thank Healthwatch at this point for their hard work in terms of compiling this data. I know that, Matt, given what you've said before, wasn't easy, given the circumstances that you're working in. And as somebody with a disability myself, I know that many people find it difficult to communicate issues such as this. So anything that brings those to light is really important. So we absolutely would welcome some speedy follow-up on this. We'll speak a little bit more about what that would look like, but I want to take Roy's questions at this point in their entirety. Well, I'll tell you what, Roy, let's do them one by one, if that's okay. So you ask your question, then you get a response, then we move to the next question, and then I'll go to the members of the panel.
Okay. Yes, there's three questions. The first one does relate to the minutes of the panel rather than the Healthwatch report. So I know that's a little bit.
Do it now, and I'll give you an answer. Okay. Kerry will give you an answer.
Okay. On page 12 of the minutes of the last meeting, Councillor Crawford was quoted as saying he would raise the issue of a cost-benefit analysis of the council's social care charging policy to the responsible cabinet member for finance, and so it's an issue about has this been done and what is the outcome. And then Kerry also agreed to bring a report to the panel on the impact of recent government changes relating to the charging system. And I realise that probably the government probably hasn't brought forward many of their policy guidance on this, but it'd be interesting to know if there's a date for this report to come back to the panel.
Okay, so let me take that first, and Kerry's got an answer on the second point. In terms of the social care charging question, I haven't yet posed this to the Cabinet Member for Finance or the Cabinet Members for Health, but I will. The reason I haven't done it yet is I was advised it's best to wait for both the national government's budgeting process and budget to take place so that we knew what the situation was with social care. As you know, the budget didn't necessarily resolve much of that issue for us, unfortunately. And we also have a council budgetary process in train at the moment. And there's a second point which Kerry's got an answer on the broader report, but they're slightly interlinked to my eyes. So Kerry has agreed to bring a report. We're waiting for compilation of some information, but I haven't told Kerry this yet, but I hope to have that report imminently in terms of scheduling it into the committee's work programme. And it may be, to be honest with you, Roy, and be completely candid, that actually taking that report first, using some of that information that comes out of that report, would frame a better request for information or policy objectives to the Cabinet. I'm entirely open on how that approach would work, but I wanted to make sure that we had the commitment of the report first to underline some of those changes to social care, to perhaps examine the policy at present in some detail, and then to frame future questions that we may ask. But I have to be honest with you, in terms of what I've done at present, it was more about setting up the report so that it reflects what we want to see in it, getting that report to the panel, because pre-scrutiny for me is very important. Anyway, I've talked for much longer than I expected on this bit. Kerry's got an answer on in some more detail on what he sees the report giving you, and then we'll come back to you.
Thank you, Chair. So we're still waiting national guidance, and this will come through national government and also through national organisations such as ADAS and SIPFA in terms of implementation of the charging arrangements. There's going to be some significant complexities in terms of understanding people's spend. if you think of people moving around the country and spending their spend on care costs in different authorities and how that's all going to be dealt with. So the national guidance is going to be absolutely key to any implementation, to the implementation of the changes to the charging arrangements. As soon as we've got that guidance, Chair and Roy, I'll ensure that I bring the information back to the committee for your oversight.
Yeah, okay. So at the moment it's a work in progress, but I have secured the commitment on the report from Kerry. His team are going to be working on that, and he knows I would like to take that as soon as possible. And I think contributions from your group and others will shape a more detailed review of policy. And it's just my view, but I think that's the best way to go about it at the moment. But as I say,
Yes.
I wanted to be upfront with you about what I had and hadn't done.
Yes, thank you for that. I realize that it's not a straightforward question. It is pretty detailed about the way the charging system works in practice, and what its benefits or its costs are for the council and for service users and carers. There is a link slightly to the Health Watch report. If I could just suggest that our own information tends to suggest that carers and service users were a bit concerned that they were still receiving bills for services from Ealing Council, and when services were not being delivered really, in terms of obviously the lockdown meant that there was no daycare virtually, and quite realistically, I understand why we couldn't have services open following during the pandemic. But obviously, whether there should be an amnesty for payments for services, and I realize that there were some services going forward by telephone or by outreach or by Zoom calls, but they were very, very, very not really hitting the mark really, because a Zoom call of 5 or 10 minutes or up to an hour per week is not really the same as some of the services that people were receiving beforehand. So I don't know if Matt would say whether the finance issue came up during his research, but certainly it does come up on a regular basis in our discussions.
So I don't want to speak for anyone else. Matt was shaking his head just a moment ago. What I would say, Roy, is I'm happy to take that under advisement that your sort of reporting or your work has uncovered this issue. I'm sure Kerry and colleagues would look at cases where it's believed that people are being charged for things that they have not received, because clearly a good deal of common sense should come into this. So, I'm sure Kerry would want to examine that, and we'll make sure that that takes place. If anyone has any evidence of that, then communicate it to us, and we'll take it forward. I'm sure. I don't want to speak for the council in its entirety, but I'm sure we can look into that and rescind demands for payment if that's appropriate.
Thanks a lot. Thanks. Okay, I'll move over to question 2. Just to say that having read the full Health Watch report and listened to the presentation tonight, you'll be aware, Matt, that we do have a number of criticisms of the way the report was put together and planned, and about the nature of the questions and how they were put forward really. And it seems to be in two different ways of doing it, either group discussion or individual filling in forms. And so I just say we have already made made plans for a meeting with Matt and Health Watch to look at some of these criticisms. So I'm not going to go into that tonight, but that is something that we want to do with Health Watch. And perhaps if this sort of report is the start of other reports, and we agree with a lot that's in there, maybe we will be able to have some fruitful discussions with Matt and his team, and so for further reports that are going to be done in the future. In terms of the actual question on the order paper, we are very concerned about nearly 24% of those surveyed said that their services had been cut or that they did not receive enough support. What measures can health and social services put in place to improve this situation? And obviously, I realize that you've got a list of recommendations, and then we've heard about an action plan. So maybe I can just rephrase it and ask, when will this action plan come back to the scrutiny panel?
So that part is to be determined, Roy. I think it's important that we agree that before we finish this item this evening, but I'll defer to Kerry in terms of what is most appropriate. I would just say, you know, having worked with Matt and had him as a member of this panel, I'm sure he will take on board any changes in approach that would be beneficial. You know, we all want the most comprehensive research, and I think that would be important. But you know, I've impressed upon Kerry the need for us to try and get this up and running as quickly as possible. But I think Kerry's going to talk about the system-wide full council response to this report in detail himself.
Thank you, Chair. So we've already started pulling together the framework for implementing and reviewing recommendations. I would suggest that the working document will be an ongoing piece of work. So I would suggest that we look to bring an initial piece back to the next meeting and thereafter update at future meetings, Chair.
So my suggestion is that we take something immediate, an item at the next meeting, even if that's a report for information, and that we table at least an information report on progress for every subsequent meeting until such time as the future panel considers it completed. Hopefully, Roy, that gives you an idea of how seriously we want to measure progress against.
Yeah, thank you. I think you Councillor Crawford, you have taken on board on a number of these meetings the sort of health inequalities. I think what we're looking at tonight is social care inequalities across the borough, and these have been pointed out in the Health Watch report, and I think that's something that needs to be addressed. So I look forward to a future report. Thanks. So I'll move on to the third question, if that's all right. Yeah. So the third question is about domiciliary care, which is a very high component of the social care services for the people dealt with in the Health Watch report. And according to a BBC News report, Ealing is the fourth lowest payer of home care rates in the country. Ealing pays an average of £15 per hour to home care agencies. This is lower than the rest of the London boroughs, and it begs the question as to whether the quality of these services is being compromised. Also, we need to ask what is left to pay hard-pressed home carers after the agency deducts the arrangement and the administration fees. Is it really enough that's actually being paid per hour to home carers?
Okay, I'm going to hand to Kerry on this one.
Thank you, Chair, and thank you for the question, Roy. So, interestingly, the information that the BBC published we considered inaccurate. A recent report that was commissioned by the council and completed by a trusted provider called Care Analytics showed that Ealing has the 8th lowest average rate of pay for home care in London. Statistics aside, just to provide you assurance that, and I think I've mentioned this in previous meetings, that we only procure new domiciliary care services, but from providers that are good or outstanding rated by CQC. And this is seen as a strong driver of quality within the sector in the borough. Within Ealing, we've got a strong and buoyant market with over 160 providers on our Ealing dynamic purchasing system. So this reflects a healthy and dynamic home care market in Ealing. There are a number of micro providers in Ealing, which reflects a leaner approach to provision of services, and therefore we believe this is helping to manage the cost of spend within the sector. Also, I think it's important for us to state that in Ealing officers, we take it very seriously the need to effectively manage how we spend council taxpayers' monies, and therefore it's important that we get the absolute best value that we can for every pound spent on behalf of local council taxpayers. In terms of where there's concerns about quality, we have very strong interactions with the market, and where there are concerns about the quality of services being provided locally, we will and do step in and end our contracts with those providers. There are real and ongoing issues with regards and concerns with regards to the long-term funding arrangements for social care, especially with the background of increasing demands and complexity due to demographic growth and the impact of the pandemic. As you're aware, the council's made a clear commitment to ensure that frontline staff receive fair pay and contract conditions. And in Ealing, we're also working with the Ealing Care Cooperative to look at developing an alternative model of domiciliary care provision within the sector. Thank you, Chair.
Thank you, Kerry.
Roy, thank you.
Can I? Yeah, sorry, I was going to come to you to see if you had any closing comments, because
yes, sorry, I don't want to prolong this debate, but perhaps if the BBC report is inaccurate, then is someone going to point out to the BBC that they've produced inaccurate statistics about the average home care rates across the country, which put Ealing very low down in that. I think that I have no reason I've got no details that would indicate that what Kerry's saying is not what is happening in Ealing. But on the other hand, why would we let this sort of information go ahead from the BBC? Thanks.
Well, yeah. So I can't answer for that. I would expect our communications team to have been in touch with BBC in respect of what the actual position is. It's obviously a BBC editorial decision as to whether they print that information and how they run with their story. But I will check with Kerry and colleagues as to sort of outside of this meeting as to what discussion we've had about that, and actually what the accurate statistics are. I mean, that would be useful, Kerry, if you can share some of that information in time, so that the panel has a complete picture, and Roy and his group have a complete picture, and we can make sure that where there are discrepancies, they are looked at. I think that's the best way to respond to that. Okay. Roy, thank you as always for your participation.
Okay, thank you very much. Thanks.
So I did want to speak just about some of the more general points in the recommendations, but I've been speaking for quite some time. I'd like to see if any colleagues have issues they would like to raise. I know nobody's indicated, but I want to give them the opportunity to do so. Yeah. So let's go to Councillor Conti first, please.
Thanks, Chair. It was just really on sort of the digital communication sort of concerns that were raised in the report. And obviously there was quite a significant number of people that felt that they weren't able to access or gain information or access services due to sort of the digitalization of how people access those. And it wasn't just about not having the skills, I think you said, Matt, and what it says in the report, it's that they felt they didn't actually have the facilities to do that. And I think it's it's more of a comment, but I guess a try and tie question is that I guess my concern is how do we move that forward, because everything is becoming more digitalized, and clearly we can't, and people are becoming more and more excluded. And I think often what you hear is, well, don't they have a relative, don't they have a friend or a neighbor who can help them do that or access, you know, the services digitally with some assistance? But then actually the end user is becoming more distant from the service and the information they want to have. So how do we, going forward and looking into the future, how do we bridge that gap? You know, how do we make sure that, I guess, our services in the council are accessible, information is accessible and given to people in a way when they are digitally excluded, but also how do they continue to make sure they're accessing wider services? And obviously the report talks about NHS services, etc. as well. But what can we do to make sure that exclusion doesn't happen?
Kerry, did you want to go first? Or?
Thank you. I think it's a really good point, Councillor Conti, and this is something that we've been doing within the Mental Health Partnership Board and looking at the various areas of digital exclusion and what it means for people who've got varying needs within the community. There's pieces of work looking at providing the hardware to individuals, so you're narrowing the divide. There's work looking at and developing training for people so that they can use that hardware. But there's also a real consciousness that not everybody wants or is able to use digital communication tools. And I think we had some of that discussion earlier when we were talking about the vaccination and using the app. Not everybody can use apps or smartphones, and there's a lot of work being done at the moment with the voluntary sector, specifically for people with mental health needs, to maintain focus on physical forms of communication as well as digital forms of communication, and certainly some of our really good voluntary sector providers that we've got in Ealing are continuing to use physical newsletters rather than shifting everything online, and that's been a real bonus, I think, in ensuring that gap is narrowed. So it's looking at the two sides, narrowing the gap, providing the training, but also maintaining and using alternative forms of communication.
Sorry, Matt. Yeah, go ahead.
Thank you very much. Yeah, it's just to reiterate Kerry's points really, because he's covered it all now. But the two things I would say is first and foremost looking at, and it's in the recommendations, how we could maybe start to explore standardizing a skills training for the Ealing Borough that could be implemented by several community organisations. If we had a kind of standard template that was agreed upon, that we could then deliver to individuals who required this training, that would be one initiative which I think could close that gap. And then the other is, which wasn't necessarily in the recommendations, but it was referenced by a number of people in the report, that they would be perfectly happy to almost regress from digital information, as long as they had that trusted source of information that they knew they were able to go to receive physical copies of whatever correspondence they needed. But it's identifying and establishing that trusted source of information for these individuals. And then from there, you can start to produce physical material that can support them.
Yeah, so I think it's also speaks to a wider problem right across the council about how we engage with certain parts of the population, really, particularly as we have an ageing population. I don't want to misinterpret what Councillor Conti is saying, but I think we have this problem across a wide range of council departments. I certainly see it in terms of casework, where people are instructed to use online reporting tools or apps or other systems that they just aren't capable of using, and we do almost have a digital deficit in that respect, that a lot of people are going to be locked out of liaising with the council, and it's too important to not challenge this appropriately. So I think the question is about how individually we can refine services for users. You know, that's going to be very difficult, probably across a wide scale, but certainly where we have regular contact with individuals, you know, how much can we shape the service towards their preferences in terms of how we communicate with them. Kerry, and then I've got colleagues have woken up now and want to ask some questions on this.
Sorry, Councillor Crawford, I wanted to sort of do a summing up before Alan and Piotr came in. So if I can go
please.
after them.
Oh, okay. Yeah, no problem. Right, let's do that then. Alan Cook, you ready?
Yep. Just as a point of interest, actually, Ealing Community Partners, of which ESOL is part of, are actually going to be doing a digital project where we're supposed to be helping people to get access to equipment and actually teaching them how to use it. So that is in the pipeline as well. So not only is the council doing something, but Ealing Community Partners will be doing a project going forward.
Lovely, thanks, Alan. I mean, it'd be useful if you could share some details, or colleagues could share some details of those projects, so that perhaps we can signpost people to them when you're ready to do so.
It's still in the discussion stage at the moment. It's early stages. We only had a meeting last week about it.
Excellent. Okay. Well, we'll wait for updates when they become available. Piotr, I assume it's on a similar train of thought.
It's on a similar train of thought. I just wanted to make sure that everybody understands this is not a problem that's going to go away with time. I'll give you two examples. One is my mother, who's 90, almost 91. 2 years ago, she was absolutely fine on the internet. She was surfing, she was doing emails. Now, because of loss of sight and because of loss of physical capacity, she cannot use any of these methods. So the training or providing of materials for her is irrelevant. And also some of the people we talk to with our community transport, looking at, for example, applying for things online for TfL or things like this, they had the capacity, they no longer have that capacity, either due to mental or physical or other reasons. So let's not think that this is going to go away as we have the younger generations who have been trained coming up. People do lose these capabilities as well. I just wanted to make that point.
Absolutely, that's really important, and thank you for making it. So what I'm going to do, I'm going to bring Kerry in to do his summations here, and then we can pick up other points once he's done that.
Thank you, Chair. It was just to say this has been a really important survey that's been completed by Healthwatch. I'm not aware of any other authorities that have done something similar at this stage. We know how national government are kicking the can up the road in terms of doing any national reviews into the impacts of the pandemic. I think that this committee requesting this report has taken a brave step, but a very important step to gathering information about the impacts of the pandemic on the communities we serve in Ealing. I think some of the comparative information as it comes up will show that the work that's been done in Ealing by the council officers, the voluntary sector and NHS partners has been strong and has been significant, but the lessons learned are important for us today and we need to take those forward.
Okay, thanks, Kerry. I don't see anyone else indicating, so I'm going to move on in a second. What I would just take away is those points made by Councillor Conti, Piotr and Alan on this particular cohort and how people access services. Everybody's absolutely right in terms of this is a key group for the council. You know, it's a group that will only grow in terms of people who need services. We struggle, and you know, I don't want to criticise any of our officers openly here because I know how hard this is, but we do struggle to target provision to people who need it the most. That is clear in terms of the information that Matt's organisation has put before us. you know, the panel should know the difficulties of the last couple of years, and, you know, that is very difficult. But I do think we have an opportunity in Ealing to build on the foundations of some of that Ealing Together work and the work of organisations such as Ealing Community Partners, Ealing Community Transport and Healthwatch themselves, to put together a framework that is much more modern and much easier for people to use. I would just say it could be as simple as having a more dedicated and well publicised hotline number, or something that allows carers, disabled people themselves, or people who have concerns about a particular individual, to communicate that directly with the council. I know there'd be logistical issues with staffing that hotline for sure, but it's just something that I feel a clearer publicised route to reporting would be really useful for a lot of these people in terms of how I've done what the stuff I've picked up with my own constituents. But that's very much off my own back rather than something I've consulted with everybody about. But it's just something that strikes me as something worth considering. Look, what I would say is this is absolutely the start of work that we will do as a panel to look at this. I know Matt's got more reports. Kerry's committed to coming back to us on this particular report, and I think we will go wider than simply these areas in future. And what I would say to colleagues, if they don't want to ask questions now, if they have comments, they can feed them into the three of us between the meetings, and we'll pick this up next time. So I think it's a useful start, but that's all it is at the moment. We can't be complacent as to the challenges. In that case, I'm going to move on to the enter and view mental health hostels. Matt, I think this is you again.
It is,
at least to start with. Yeah, go ahead.
Yeah, actually, hope that's a good point. Hopefully Kerry can come in towards the end as well. So what I'm going to do is attempt to give you an overview of the three enter and view visits that we conducted to 3 mental health hostels, taking place in around June and July of this year. We visited Shirley Gardens, Community Road and Collect House. And this is obviously part of the wider piece of work that's going on with Ealing Council and other partners around the tragic death of Jenny Foote. This is kind of how the visits came about and how we used our enter and view program. So to give you an overview, good practice was consistent across all 3 hostels. The hostels were kept clean, very well maintained, and were very welcoming. All residents spoke very highly of staff and management. Staff members spoke very highly of the management themselves as well. And our enter and view representatives at each hostel witnessed very respectful and dignified interactions between staff and residents, and between staff themselves as well. So this was really good to see. Across all 3 hostels, there appears to be ample training and development for members of staff. And this shows through how well versed staff were in terms of the support plans that were in place for residents. This also included things like risk assessment and crisis management plans in place, understanding medication administration for individuals, and then a real focus on how to best empower and support residents in their care plan and their move on plan, to ensure that individuals are really proactive in their approach to moving on from the hostels. This is something that I'll return to later on in the recommendations. So particular things include kind of emotional support for individuals, proactive goal setting, and then more practical day-to-day matters, such as dietary needs, budget management and health appointments, and things like that. Staff across all 3 hostels were aware of the operational procedures in place. So this includes things like what to do in the event of a fire, any safeguarding concerns, complaints and feedback from residents and or family members. And all 3 hostels seem to have a comprehensive medication administration plan in place, which included some form of handover. The more day-to-day activities in terms of activities themselves, or meal times were consistently good across all 3 hostels, with residents being provided with a lot of options for meal times, being involved in the making process and the buying process for their food and their meals. Any support that they needed in terms of their diet or actually making the meals was provided to them. And this was really the same for activities as well. So although it was really difficult throughout the lockdown to engage in all the activities they wanted to, residents' feedback was taken on board by staff members, and where possible, their suggestions for activities were implemented. Although some residents did mention that during the time where public spaces were closed within the hostels, this did have an impact on their mental well-being. And we're just kind of seeing the activities increase, which hopefully attends to that. That's it for the kind of overview, areas of good practice. And then I wanted to move on to the recommendations for all 3 hostels. And what we see when looking at all 3 reports is kind of a tiered approach to the recommendations. So at the bottom level on tier 1, we've got kind of the more practical matters. So it's ensuring that all residents' mealtime preferences are attended to, all residents' suggestions for activities are heard. The notice boards at the residents are kept up to date, particularly around what residents are entitled to in terms of their health and social care needs. This also includes ensuring that COVID-19 infection control is kept to a high standard, as it was across all 3 hostels. There were just a couple of issues around the allocation of PPE for these hostels, which should be reviewed in the event of any other outbreaks or lockdowns or scenarios such as that. And then lastly, just ensuring that residents' signage is clear. For Colette House in particular, there are a lot of stairways and corridors that could be quite confusing for visitors in particular, but even residents as well. So some kind of internal signage would be helpful for that residents in particular. Tier 2 then looks at the kind of more operational side of things. So this is ensuring that staff are or have enough time to attend specific trainings and any kind of workshops that they can use. This is looking at standardizing the induction process for members of staff, because while most of them are quite comprehensive in terms of the feedback they gave for us, it did vary quite a lot in terms of what training and development they received, how long their induction was. It ranged from some people saying 2 weeks to some people saying 6 months. And obviously there are kind of other factors involved in this, but a standardized procedure for induction would be very useful. Also some sort of standardized process around medication administration, because although it was reasonably comprehensive, it was different across all 3 hostels. And I think it would be worth standardizing this process. And then particularly for Colette House, it's addressing the fire safety. we noted that although fire extinguishers had been removed as a result of the death of Jenny Foote, they have not been replaced with an alternative fire deterrent. London Serenians mentioned that they're able to contact the fire service immediately if anything were to happen, but I think it's important to have an alternative fire deterrent in place of those fire extinguishers at the residence. Lastly, we come on to the third tier, and this is kind of the main finding across all three hostels. And this is around the move-on plans for residents. At all three residents, there were individuals who had been there for well over the kind of average time for individuals to stay at the hostels, which is often a year and a half. So some residents were there for kind of 2 or 3 years, some residents there for 5 years, and some residents there for 10 years or more. So really understanding how we can further adapt individuals' move-on plans to ensure that we're proactively aiming for that 12 to 18-month mark is really important to ensure that the health of these individuals are progressing, and that spaces are opening up for individuals that need access to these hostels as well. And this is the kind of main area of recommendation that Healthwatch hopes to follow up with and see change in, and anything we can do to support that, we will do. So that's my overview of the three reports, and happy to, again, pass to Kerry or answer any questions.
Thanks, Matt. Let's see if Kerry wants to come in. I'm sure he does. Yeah.
Yes, please, Chair. So as Matt mentioned at the beginning, the interim reviews were requested as part of our response to the investigation into the tragic death of Jenny Foote within one of the mental health hostels in the borough. I think this is a really useful step in terms of our commissioning arrangements with the providers at the mental health hostels, and certainly the length of stay that Matt has raised is something that is a significant concern with us, and we've been working with the Mental Health Trust and other partners to review and to maximise supporting people moving to placements of least constraint, so enabling people to access alternative accommodation within the community where there's less support as required to meet people's needs. I would suggest, Chair, that we use these reports as part of our future discussions about the investigation into Jenny Foote's death that we heard last year, and bring back a more detailed update to you. And I think that would be more cross-cutting in the new year.
Well, thank you. I've got Leanne, are you indicating? Sorry, I'm trying to see. Sorry, yeah, please come in now if you would like to. I think.
Thanks very much. I'm here for Chris Hilton because he's on holiday from West London Trust, and I'm the Executive Director for Forensic Services and Services at Broadmoor Hospital. So we've got a particular interest, particularly on the report around Colette House. I was a little concerned to read about the fire extinguishers. In inpatient settings, we have fire extinguishers on the wards, but they're in locked wooden boxes. And I would think that maybe that's something that Colette House should consider. Because with the demands on the emergency services, you might be waiting some time for a fire engine. The only other couple of points I wanted to make, I think, was on page 14 of the report around safeguarding, and just curious about, was there consideration given to the Mental Capacity Act and DOLS, Matt, when you looked at safeguarding practices?
I don't think it was specifically, no.
Okay, that's fine. And just my final point really about move-on plans. I mean, Kerry's aware of this, but quite often service users coming from secure services need much longer than 12 to 18 months in hostels. Some actually need a hostel for life, dependent on their risks. So I think that just needs to be factored in. Thanks very much.
Thank you, Leanne. So absolutely, that's really important. I was going to say, actually, this report shows the importance of Healthwatch in regards to this work, given their ability to be able to go into lots of these places, which is something that not everybody, certainly we as a panel, are not able to do. So that's really important, and that investigative work is vital, particularly when we're dealing with something quite so tragic as the event that that we have discussed as a panel previously. I did just want to flag up that Roy has put in the chat about looking at using maybe sprinkler systems or other technical devices. I'm sure there are a range of things that are available, but like Leanne, I was a little bit concerned about the situation with the fire extinguishers, and indeed the idea that I don't think, this is me adding a bit of commentary, but I don't think the emergency services are going to be in a position to reach their previous productivity and capacity response levels for some time, you know, particularly going into winter. So we might need to look creatively at what the solutions are. But I know, Matt, that you'll be committed to working through these recommendations. And I think I would take on board Kerry's point about if we can have that cross-cutting, cross-departmental and cross-agency discussion about what the next steps are, I think that would be really useful. And I know that in our previous discussions with Dr. Hilton, he was keen to establish that as well, if it hasn't already been done. So look, I think there's a positive from this analysis that we can work together to improve standards, and I'll sort of defer to colleagues once they've had more detailed discussions about what the best way to present that progress is, and keep the panel updated on that. But I think if we can hear from the three of you more regularly on this, that would be lovely. And Leanne, that would be great if you could share that sort of best practice knowledge with everybody. I think that would go away to making things immediately more safe. And on your final point, almost around what the suitability for people is to move on from certain settings, I think that's really important, because a lot of us as members of this panel and a lot of members of the public who will engage with this discussion simply will not know about the gravity of problems and issues that need to be dealt with here. So, you know, we need to look at individual plans for individual residents tailored to the circumstances that they find themselves in. Obviously, investigating where things are not working appropriately, which Matt and his team have signposted us to in regards to these three reports, which are very detailed. Now, Alan is waiting to come in, so I want to go to him.
Yeah, sorry, Chair. It was just a comment. Something that, if you look at Shirley Gardens, that is interesting, is that we were told that several residents had been there for 15 to 20 years. Now, that is a concern to me, because actually there are only 7 beds there, and at the time of the actual interim view, there were only 6 residents. So that tends to suggest that we're talking a minimum of 33%, possibly 50% or maybe more, people being there for that length of time, where if you've got people there for a long time, it's possibly because there's not enough capacity in the system to allow them to move on to something. But at the same time, from my point, looking at it, is a bit of a worry that if you've got people there, a number of people there that are actually getting used to being there for a long time, and then have other people coming in for shorter stays sort of thing, it's possibly upsetting to them. And I think that's something that Scrutiny should take into account, is to And the fact that actually CQC don't actually raise that issue, and that Health Watch has raised the issue of these length of stays, I think is important. The fact that CQC don't mention it.
I think you raise two important points there, at least in my view, Alan. The first is with regarding to the capacity within the sector, which is something that Kerry and I have had discussions about, and is a familiar refrain from this panel in terms of how we tackle that with unfortunately with great difficulty at the moment. And then I think the second point relates to what I was saying previously about the vital role of Health Watch, because I think the last time I was we had a meeting, I said I was, and I think I shared this view with you at the time, Alan, I was skeptical of how successful Health Watch would be in those early days in terms of being able to investigate some of these things. But the fact that they're drawing out things that CQC reports haven't, it is really beneficial. I wondered if I could just go around with Matt and Kerry and maybe Leanne as well, if she feels appropriate, just to speak about that capacity issue and how we handle that. But please, if people don't want to, just tell me to shut up. I'm used to it. Kerry.
I think there's issues and there are challenges in terms of capacity. We know one of the big challenges in Ealing is suitable housing for people to move through into the community as part of recovery planning for individuals. And I think just to go back to Leanne's point, and also Alan's, because it's pretty much saying the same thing. Some people do need much longer term support, and maybe these hostels aren't the right place, and that's part of the planning that needs to be implemented.
Leanne?
That's basically what I was going to say as well, actually. 15 to 20 years seems an awful long time, when actually what they really need is a home for life, and that's not a hostel. I mean, that's not the function. I'll mention it to Chris because my understanding is that most of the residents in these other hostels are not forensic patients, so they would come under Chris's area of responsibility. So I'll speak to him about it.
Sure, and we'll follow up outside the meeting. Matt, is there anything you'd like to add from your no? Okay, look, I think that's actually really useful, because we had a detailed discussion about Colette House previously, and that response and progress in those actions is still ongoing. But I think it's really useful to have had these three reports. So there are some things that Kerry is going to bring back to us with regards to progress, and I think the broader points about capacity and how we deal with reporting and what the role for Health Watch is are things we can take forward. We certainly want to work closely with everybody going forward, as I've intimated. Right, we have one more Health Watch report to take this evening, and that's the Q2 patient experience report. Matt.
Yes, yeah, a bit heavy on the Health Watch this evening. I'm just going to share my screen, so hopefully you can all see this. So, yeah, so this is the similar infographic to what we used last time to report on the patient experience Q2 update this quarter. So out of the 1,234 individuals who provided feedback, 67 were positive across all service categories, and 22% were negative. In total, we received 462 reviews for GP surgeries, 253 for hospitals, and 238 for dentists, which we'll come on to later on. So for GP services in particular, the main theme this quarter was treatment and care. And it's really great to see that 82% of individuals were satisfied with the overall quality of care they received by their GP. Unfortunately, only 56% were positive about their GP experience, and this is probably contributed to by issues with access and administration, so booking appointments or waiting times, which is further down in this infographic. And then 60% were happy with the level of support that they received. So this is very good to see, but obviously there can still be some improvement there. Again, it may be related to other things. The theme that I was really excited to present on this evening was around GP staff, because this quarter we've seen a 20% increase in the amount of positive feedback that GP staff received, taking it to 59%. So this is the highest positive sentiment rating for GP staff that we've seen throughout the entire pandemic. We haven't seen a percentage like this since before March 2020. So this is really good to see. And it also reinforces our most recent work that I did with Neha and the CCG, understanding the 2-year trend that we're seeing for the main themes for GP services. This just reinforces the point that the pandemic was a massive factor in terms of individuals' feedback on members of staff for GP services. And we hope to see this positive sentiment increase as we move into the next quarters as well. 62% of individuals were happy with staff members' attitudes, so customer service, and the suitability of staff members who supported them at their GP. As I mentioned before, administration and access, still some areas of concern for individuals, with only 32% of individuals positive about the administration theme. So this is booking appointments, appointment availability, and kind of patient choice of what type and what time they can access an appointment. The top 3 sub-themes for all the administration theme as a whole, received at least 50% negative feedback. And again, this reinforces what we found over the last 2 years, that this is an area that needs some focus. Waiting times also received a significant percentage of negative feedback. But it's good to see that 63% of individuals believe that their GP was suitable in terms of providing the relevant and appropriate amount of care. So this does suggest that it really is these issues around appointment booking which are the main factors driving that negative feedback. Moving on to Ealing Hospital, the feedback carries on the positive trend that we've seen throughout the pandemic, with 75% of individuals saying that they received adequate support, and 100% of individuals who reference quality of care or the treatment explanation that they received at Ealing Hospital being positive in sentiment. But as you'll see from the numbers here, they were quite low in terms of sample sizes. And this is something we want to change with face-to-face visits to Ealing Hospital. This is also touched upon in the recommendations as well. Again, very positive for members of staff at Ealing Hospital. 83% of individuals who referenced the attitudes of staff at Ealing Hospital were very positive. And those who referenced staff capacity and staff suitability were mainly positive as well. There was a slight decrease in positive sentiment for Ealing Hospital staff this quarter. I believe it decreased from 95% to 83%. So nothing too drastic, but it is still recommended that the staff at Ealing Hospital and the London North West Trust just remain vigilant on this issue and maybe explore why this might be reducing slightly. And we'll obviously monitor it as the quarters go on. Moving on to other services, again, we see this positive trend for dentists. However, with our kind of focus on hearing from those who haven't had access to dental services during this quarter, we saw negative feedback increase to 19%. This also focused on quality of treatment as well as price as well. So this is an area of focus for our patient experience team to hear from those who haven't accessed dental services, as we've quite regularly reported overwhelming positive sentiment towards dental services. But this has just been for those who have been able to access it largely during this time. And we'll continue to focus on that area of work as well. Pharmacy reviews were very positive as well, with individuals referencing sufficient organisation and service management. Several service users suggested that the support they received from pharmacies was in lieu of GP support. So it's really good to see primary care services kind of working together to be able to support people where some services may not have the capacity. And lastly, COVID vaccination sites, and testing centres received overwhelming amounts of positive feedback again, with individuals referencing the professionalism of staff, the effectiveness of the service, and just effective delivery in general. Some did note that there were insufficient supplies of hand sanitizer at some of the vaccination centres. So this is just something that's kind of worth noting, and ensuring that all centres have adequate PPE. In terms of the next steps that we've taken as an organisation already off the back of this report, we're now directly contacting GP surgeries across the borough to let them know what our findings are with this report. We then give them the opportunity to provide a response, and we've received some really good response from GP practices in terms of suggesting how we could develop our patient experience program, expressing their gratitude, and also underlining quite comprehensively how they plan to improve the feedback for their particular practice. So that's really good to see, and that's something we'll continue to do. We've also done something similar with the local medical committee, providing them with the opportunity to respond to our findings and provide any context that may help kind of interpret our findings in a better way. As I mentioned previously, we've produced a 2-year review of the main areas of development for GP surgeries, which the findings in this report further reinforce, and we'll work with the CCG on this to understand how our local intelligence can feed into any kind of improvement strategies for GP practices. We continue to develop our quarterly reporting, so this is both in terms of the presentation, people's access to the report, and how widely it's promoted and distributed. And this will be helped as we kind of move back to face-to-face engagement and outreach as well. And we've continued collaborative work with the London North West Hospital Trust. So one of our recommendations, as you'll see down here, pertains to them specifically, but it's around how we start to engage with individuals face-to-face. We've been through all the necessary risk assessments and risk management procedures, and we've successfully carried out one patient experience visit to Ealing Hospital so far, and we hope to do 2 more in this quarter, and building upon that each quarter as we go forward. The recommendations, the first 2 are for us. So as an organisation, we want to conduct a comparative analysis with neighbouring boroughs to understand whether Healthwatch Hounslow and Healthwatch Hammersmith and Fulham in particular are experiencing the same issues with GP practices that we are. So this will give us a better understanding of whether these are Ealing issues or whether they're wider regional issues. And again, this was a suggestion by NAHAR and the CCG, so we hope to feed this analysis back into their work as well. and understand how we can further support it. This quarterly report did see an improvement in terms of representation of individuals, but obviously we always want to improve this, and we hope that this continues, and we're actively working to make sure that this continues in terms of gaining a representative sample of age groups, ethnicities, and wards within the borough. We also recommend that we explore whether customer service training for general practices is a adequate next step or a relevant next step. The findings in this report suggest that things are kind of naturally improving. However, it would be useful to establish whether customer service training for members of staff of GP practices would further improve this, and whether it's feasible at this stage. We also recommend that the West London Trust work more closely with ourselves, as we're currently trying to gather as much feedback as possible on mental health services in the borough. And we would welcome any support that could come from the trust. So hopefully those conversations can take place. Number 5, as I mentioned before, is attending Ealing Hospital as a patient experience team to start to speak to people face to face and gain further insight into how people's hospital experiences are. And then lastly, as I've previously mentioned, is to continue this collaborative work we've done with the North West London CCG to support any primary care improvement strategies that we can with our local intelligence. And I'm happy to take any questions.
Well, okay, thanks, Matt. I thought it's a really comprehensive report, and I'm glad that we've improved some of the sort of representation and diversity issues, although I know that there's still some, you say there's still some work to go on that. I'm going to take Piotr because he's indicated, and my battery is running very low, so if I drop off, this is just a warning to Councillor Conti that he might need to take over. I'm going to go and try plugging myself in while Piotr asks his question to Matt.
Okay, my one very short question to Matt, and I was my jaw actually dropped towards the end of your very eloquent putting over of the results there, Matt. But when you said that I believe you said that the GP experience was naturally improving, and yet I think what sticks out like a sore thumb is the 56% of people who are happy with this GP experience, you know, with the getting of appointments, etc., etc. And I was just surprised that there wasn't more focus on that clear throbbing thumb that stands up from the wonderful results of the vaccination centres, very good results from Ealing Hospital, dentists, etc. And I'm just thinking if it perhaps could have been given a bit more focus in the next steps. I don't know what your thoughts on that are, Matt.
Yeah, it is a good point. I guess maybe from a personal perspective, I was excited to present the fact that we saw an increase in positive feedback for staff customer service, and maybe, sorry, maybe I've possibly become a bit jaded myself in terms of consistently reporting on this negative feedback we receive around access and administration for GP practices. This is something that we're working on behind the scenes with Nehar and colleagues. So we're hoping that we can support, we can contribute to any improvement strategies that there are. But you're right. Maybe this is somewhat of an oversight, and it needs to be paid more attention.
So if I can add to this, it links on to our next item. We are going to take a report next time around the progress towards the Ealing GP standard. So I think there'll be some crossover in terms of reporting some of that anecdotal or otherwise feedback with regards to accessing this particular area. So I think the Health Watch reporting will be helpful, but we'll be able to pose some deeper questions on that with some up-to-date data as well, I hope. So hopefully that reassures you that we'll all be taking this seriously going forward. I just want to check that nobody else wants to ask any questions, because otherwise what we'll do, we'll thank Matt for his hard work and his colleagues' hard work and move on to the work programme. So one last call for questions on this item, please, from colleagues. And I don't see any, so I'm just scrolling down my participants list, and I can't see any questions. So Matt, thank you very much. You know, we rely on Health Watch to give us the feelings on the ground, and it's clear that you're doing some very good work, and hopefully some of this will feed in, as I say, to that item next month. But we look forward to taking the next set of reports, and I should say that applies to all of the reports you put forward to us this evening, particularly the previous two being very useful in terms of ongoing work for the panel. So thank you. And I'll just very briefly then deal with the work programme in respect of that next meeting in January. So it is proposed that we will take an Accessing Primary Healthcare in Ealing report, which would include an update on the Ealing standard, amongst other things, and we will take a look at health inequalities, which is something that Anna Bryden will be leading on in terms of not just COVID, but also some non-COVID related stuff. And I would stress that that's a early start to some of that work on health inequalities, which is likely to need to stretch over next year's panel as well, I think, in order to be effective. What I would say to Anna Marie in terms of scheduling in what we've agreed this evening is that we should probably have as a third item there an opportunity for Kerry and colleagues to bring forward their progress report on some of the lessons learned in that first Adult Social Care Health Watch hybrid report on what we've learned from the pandemic, which I think, correct me if I'm wrong, colleagues, we agreed earlier this evening. So yeah, I've got people nodding at me. Thank you. I thought I was going mad slightly there. So what I would say with the work programme, of course, is if colleagues have topics they would like to consider or we need to deal with in greater depth, please let myself and Councillor Conti know, and we will take them up at the pre-meeting. There's no limit to what we can consider or time limits. We'll try and fit them in where possible. I don't have any more business to transact for this evening. I know it's been heavy in terms of the reports and the things we've been considering, but I think it's been really beneficial. Thank you very much for your time and your consideration, and I look forward